My name is Donna Edwards and welcome to Addiction Counselor CEU. Today we will be discussing stages of change-based treatment planner. Precontemplation stage of change. The intervention is a harm reduction, short-term, measurable goal. An example is a client will apply 3 stages to reduce risk harm related to ongoing substance use. The therapist will link client to resources for overdose prevention. The therapist will assess clients to address physical health needs related to substance use. Therapists will assist clients with obtaining insurance. Clients and family will receive training in overdose prevention and Narcan administration. Therapists will educate clients on safe practices for ongoing substance use, such as not using alone, buying from a trusted source, reducing dose following periods of abstinence, etc. Therapists will develop safety plan for clients and clients' affected family members. Remember to consider safety planning for children in the home. The interventions for this change is building rapport, short-term measurable goal. Example, clients will rate improved trust with therapists from a 3 to a 5 on a 1 to 10 scale to set stage for ongoing work. Therapists will explore clients' interests, strengths, and goals. Therapists will work with clients to develop agreed upon goals. The intervention for this is the motivation enhancement, short-term measurable goal. Example, clients will identify increased motivation to reduce substance use from 2 to 4 on a readiness ruler. Therapists will explore benefits and risks of use. Therapists will utilize motivational interviewing to explore themes of ambivalence. Therapists will assist clients in identifying their support system. Therapists will explore ways to increase external motivation through collateral contacts, other service providers, or the legal system. The therapist should utilize regular supervision regarding engaging external motivators and meeting the clients where they are at. The interventions, case management short-term measurable goal. Example, clients will reduce days homeless from 30 per month to 15 per month. Therapists will identify case management needs and assess clients with resource linkages as appropriate. Therapists will assist clients with obtaining insurance. The interventions, family intervention short-term measurable goal. Example, client's family will be able to identify 3 coping strategies they can apply related to client's ongoing substance use. Therapists will provide education about substance use disorders to client's family. Therapists will provide self-care resources to client's family. Therapists will provide consultation to client's family regarding ways to respond when clients or family is in crisis. Therapists will provide client's family with a copy of the safety plan and discuss safety for affected family members and clients. At this stage, these interventions occur separate from the client. Here is some intervention for co-occurring disorders, short-term measurable goal. Example, clients will apply 3 safe behavioral coping strategies to use when distressed as an alternative to substance use. Therapists will help clients identify, utilize coping strategies. Therapists will provide psychoeducation about mental health and co-occurring disorders. Please note that supportive listening, which does not enhance change, talk is contraindicated for persons in pre-contemplation stage of change. Here's some interventions for group facilitation, short-term measurable goal example. Clients will demonstrate consistent attendance and engagement in group sessions. Therapists will facilitate group discussions in which senior members of the milieu will have an opportunity to influence the clients towards change. Here are some interventions towards the assessment. The therapist will gather collateral and biopsychosocial assessments information to determine diagnosis and ASAM level of care. The contemplation stage of change. Aware problem exists, but with no commitment to action. Thinking of quitting, wondering how I affect others, maybe trying small changes. Here are some of the interventions. Motivation enhancement short-term measurable goals example. Clients will identify increased motivation to reduce substance use from a 4 to 5 on readiness ruler. Therapists will utilize motivational interviewing to explore themes of ambivalence. Therapists will provide psychoeducational on the effects of substance use. Must be factual information on effects, not scare tactics. This intervention will only be effective when the information is new to clients and resonates with their experiences. Should be used sparingly and only when it enhances client change talk. Therapists will use the miracle question to enhance motivation, confidence, and change talk. Therapists will use the readiness ruler to assess clients' motivation and confidence for change. Therapists will facilitate locus of control assessments and discussion on related themes and applications. Therapist prescribes and reviews journaling to explore motivation and enhanced change talk. Interventions on goal setting short-term measurable goal example. Clients and therapists will explore and identify one realistic achievable goal. Therapists will use client change talk to identify realistic goals for incremental change. Therapists will identify and praise incremental change accomplishments. Here are some interventions, harm reduction, short-term measurable goal examples. Clients will implement harm reduction strategies 90% of the time, evidenced by self-reports. Therapists will monitor clients' use of safety plan for overdose prevention. Therapists will provide psychoeducational on communicable disease prevention. Therapists will link client to primary care provider for medical follow-up. Therapists will process themes of powerlessness that arise as client attempts harm reduction efforts. Here are some interventions for this stage of change. Rapport building, short-term measurable goal example. Clients will increase honest self-disclosure with therapists from 50% to 75% of the time. Therapists will use supportive listening to enhance change talk. Therapists and collateral sources will define and clarify roles to ensure that therapeutic relationship is supported. Therapists will praise and cheerlead clients' change efforts. Interventions on skill development, short-term measurable goal example. Clients will be able to apply 2 coping skills as alternatives to substance use. Therapists will teach healthy coping strategies and review application of these skills. Therapists and clients will practice meditation and deep breathing exercises in weekly sessions. Therapists will assign homework related to problem solving, stress management, communication skills, and thought stopping. Therapists and clients will role play refusal skills in sessions. Therapists will provide information on healthy relationships and process client support networks. Here are some interventions: family involvement. Conjoint family therapy may be contraindicated at this stage of change, as it may have adverse motivational effects. Short-term measurable goal example: the client's family members will attend 3 educational or support activities during this review period. Therapists will provide psychoeducation to family members and collateral contacts regarding substance use and stages of change. Therapists will provide resources for family members related to Al-Anon and how to obtain their own therapy services. Therapists will continue to review and update safety plan with clients' family members. Here are some interventions for group facilitation short-term measurable goal example. Clients will demonstrate engagement with group topics, evidenced by asking questions, completing homework, and processing in sessions. Therapists will facilitate group sessions that allow members to challenge clients' discrepancies. Therapists will provide group materials and setting for clients to explore themes of change with peers. Here are some more interventions for assessment. Therapists will facilitate drug testing services to verify clients' self-report of current and recent substance use. It is recommended for the therapist to receive regular supervision and consultation during this stage, including audio or video reviewed sessions, to ensure that motivational interviewing techniques are being implemented with fidelity. Here is the preparation stage of change. Intent on taking action to address the problem. Have a plan to quit. May have cut down, can see benefits of quitting. The interventions: behavioral change short-term measurable goal example. Clients will increase days of abstinence from 0 per week to 3 per week. Therapists will assist clients in developing a plan for change. Therapists will help clients to identify triggers and strategies for avoiding or coping. Therapists will help clients develop a schedule to support sobriety. Therapists will assist clients with identifying barriers to sobriety and problem-solving solutions for these. The interventions: rapport building short-term measurable goal example. Clients will report 100% of substance use events openly and honestly with therapists. Therapists will provide accountability for agreed upon change goals. Therapists will maintain an atmosphere of safety for self-disclosure regarding substance use. Therapists will normalize relapse and provide psychoeducation on ways to move forward with change goals. The interventions for motivation enhancement short-term measurable goal example. Clients will report movement along readiness ruler from a 4 to a 7. Therapists will continue exploration of change talk and goals. Therapists will continue to use readiness ruler and confidence ruler to assess change on continuum. Therapists will use motivational interviewing questions to identify future change goals, explore motivators for change, and identify areas of increased confidence for change. Therapists will prescribe journaling and process journaling in session to explore change talk. Therapists will provide praise and affirmation for positive, incremental changes. Some of the interventions include reassesses the ASAM level of care, need short-term measurable goal examples. Clients will be linked to appropriate level of care for services based on ASAM criteria. Therapists will facilitate ASAM screening for level of care need and link clients to appropriate level of care for treatment. If a higher level of care is indicated, it is critical that these services are matched at preparation stage of change. Clients must experience success at this stage to continue with change. Therapists should be cognizant of not setting clients up for failure by not mobilizing the appropriate resource for the level of care. Individuals in the preparation stage of change are more receptive to interventions than pre-contemplation and contemplation, and may derive more benefit from higher level of care treatment than an individual in the previous stage of change. The interventions for recovery support and advocacy short-term measurable goal example, clients will implement 2 changes to improve support for recovery. The therapist will link clients to recovery support groups and a recovery support specialist or a sponsor. Therapists will provide clients with resources for local recovery support groups. Therapists will advocate for clients with collateral contacts. Here are some interventions for increased recovery skills short-term measurable goal example. Clients will demonstrate application of 2 recovery skills in daily life. Therapists will provide information and coaching on assertive communication skills. Therapists will share resources with clients regarding boundary setting. Therapists will role-play refusal skills with clients in sessions. Skills work should be balanced with motivation enhancement at this stage, and therapists should be aware of not overwhelming the client. Here are some interventions for family involvement. The goal of the family interventions at this stage is guarded supporting. Short-term measurable goal example. Clients' family members will identify 3 ways to provide helpful and positive support. Therapists will provide education and coaching to family members on ways to demonstrate helpful support to clients. Therapists will reinforce ongoing participation in Al-Anon and individual therapy for affected family members. Therapists will normalize fear and mistrust for clients' family members and will help to reframe realistic expectations. Here are some interventions for group facilitation, short-term measurable goal example. Clients will demonstrate application of group skills and themes 1 time per week. Therapists will provide recovery skills training as a part of the group curriculum. Therapists will facilitate a safe environment to explore exploration of change. Therapists will utilize group milieu to reinforce positive change steps. The action stage of change, the active modification of behavior. Have quit using, am avoiding triggers, asking others for support. The interventions for the behavioral change short-term measurable goal example is that the client will demonstrate abstinence from non-prescribed medication evidenced by urine drug screen results. The therapist will prescribe and monitor random weekly urine drug testing to support abstinence. Therapist and client will continue to assess and review treatment plan goals. Therapist will monitor appropriate matching of treatment plan goals and level of care to the client's stage of change and ASAM level of care. Therapists will reinforce participation and regular attendance at recovery support groups and treatment appointments. The interventions for motivation enhancement, short-term measurable goal example. The clients will report confidence in ability to achieve change increasing from a 4 to a 7 on the readiness ruler. Therapists will praise clients for success. Therapists will help clients to identify triggers and strategies for avoiding or coping. Therapists will provide supportive listening and normalizing ambivalent feelings. Therapists will reinforce hope for sustained change through the miracle question and discussion of others' successful change. Here are some interventions for relapse prevention. Short-term measurable goal example. Clients will develop a comprehensive relapse prevention plan and implement strategies into daily life. Therapists will help clients develop a plan to structure time schedule in support of recovery. Therapists will help clients process triggering situations as they occur. Therapists will provide psychoeducation about post-acute withdrawal. Therapists will continue to review safety plan for clients and affected family members in the event of relapse. Here are some interventions for case management short-term measurable goal example. Clients will be linked with 3 community resources during this review period to enhance recovery supports. Therapists will assist clients in finding employment. Therapists will client problem solve barriers to recovery. Therapists will provide financial education and skills training. Here are some interventions for recovery skills, short-term measurable goal example. Clients will increase application of recovery skills from 2 times per week to daily. Therapists will help clients develop skills for emotional regulation and healthy coping. Therapists will help clients build, assess, and grow a recovery lifestyle. Therapists will provide CBT skills training, including communication, healthy relationships, and mindfulness. Therapists will teach DBT skills, group, and provide individual coaching for skills implementation. Here are some interventions for co-occurring care. Short-term measurable goal example. Clients will report decreasing depressive symptoms from 4 days per week to 2 days per week. Therapists will help clients identify and focus on self-care, including healthy activities and hobbies. Therapists will assess clients' readiness for trauma processing. Readiness may be indicated when clients demonstrates minimal mastery or at-home application of coping skills. Therapists will provide psychoeducational education regarding grief and loss. Here are some interventions for family involvement, a short-term measurable goal example. Clients and family members will report improved communication from a 3 to a 9 on self-rating scale. Therapists will engage family members and support persons in treatment. Therapists will facilitate family therapy sessions focused on relationship repair and making amends. Therapists will normalize loss of trust in relationships related to substance abuse. Here are some interventions with group facilitation, short-term measurable goal example. Clients will demonstrate use of group process for support and change, evidenced by reaching out to group members and sharing personal experiences. The therapist will provide a safe space for clients to process recovery struggles and successes. Therapists will reframe and summarize group inputs into usable solutions for clients' recovery. And here is the maintenance stage of change. Sustained change, new behavior replaces old. No use in a long time, accepting myself, helping others who are still using. The intervention for motivation enhancement, short-term measurable goal example is the client will verbalize internalization of recovery values of change. Therapists will praise the client's success, help the client identify areas of change, and process their impact. Therapists will help client continue to tell the story of their recovery. Therapists will encourage clients in opportunities to help others as part of their ongoing recovery journey. Here are some interventions for relapse prevention, short-term measurable goal example. The clients will maintain abstinence from mood-altering substances, evidenced by self-reporting and urine drug screens. Therapists will prescribe random drug testing to support ongoing abstinence. Therapist and client will continue to review and update relapse prevention plan. Therapists will provide psychoeducation regarding relapse warning signs. Here are some interventions for goal setting, short-term measurable goal example. The client will identify ongoing life and recovery goals and develop continuing care plan. Therapists and clients will review prior treatment goals and discuss ongoing plan for supports and/or treatment. Therapists will refer clients to other supports and services as indicated. Therapists will facilitate case management supports for clients' ongoing goals. Here are some interventions for recovery supports, short-term measurable goal example. Clients will report ongoing participation in recovery supportive activities weekly. Therapists will check in regarding clients' social relationships and supports, and reinforce structures that enhance recovery. Therapists will provide accountability for maintenance of lifestyle changes. Interventions for termination and referral. Here is a short-term measurable goal example. Clients will demonstrate understanding of substance use as a chronic condition requiring long-term maintenance. Therapists will assess clients' readiness for termination of therapeutic relationship. Therapists will link clients to continuing care or primary care providers via a warm handoff.